Mittens on a newborn are cute, and they prevent scratches. But there is a bit more to consider before deciding to use them. Because mittens do something else, they also cover the newborn's fingers. And babies do not start having fingers at birth, of course. They already start growing at around week 9 of pregnancy. At week 12, babies typically start open and close their fingers. Fast forward to 6 months, and some babies will suck their thumb in the womb. During later ultrasounds, some are even seen opening their mouth before the fingers actually reach it, which scientists say is a sign that they are anticipating touch. So, already in the womb, by moving his hand around and touching his head, his belly, his other hand, the baby's brain has developed and learned to anticipate that when he directs his hands towards his mouth, they will touch and he will be able to suck on his fingers. This learning in the womb is wonderful, but not exactly surprising. We know that sensory play that stimulates the senses of hearing, vision, smell, taste, and, of course, touch, develop connections in the brain of children. That's why sensory toys are so popular. The news here is simply that it happens long before birth. After birth, when the baby's hand is covered in a mitten, she's kind of deprived of her first sensory toy, one that she got used to having for a long time in the womb. And it's free. Okay, but how about the scratches? Isn't pain worse than not being able to play with fingers for a week or two? Well, it is true that baby skin is much thinner and fragile than that of an adult. So you can trim her nails. There are great videos on how to do that safely. And if her relentless exploration still gets her scratches, don't worry. They generally are not deep and will heal naturally. This being said, all babies are different, and if you feel that your baby is particularly prone to hurting herself, ask your doctor whether mittens are suitable for your child. The point is, using hands and fingers to explore one's own body and environment is part of normal infant development. By preventing this brain-building exploration, mittens do more harm than good. They should not automatically be given to babies.